It's a little bit like running a marathon, except that you can't train for it. The responses have been universally, oh my God, thank you so much. It makes you feel connected in a very significant way with, women throughout history, with, women that you know, with women in your family, your mother, your grandmother, the people who, are the reason for you being here. It just makes you feel very grateful. Something like continuity of care is what a doula is there for. So that means to be there, just be there, be present with the woman from the beginning to the end, not like continuously dealing with shift changes and different doctors coming in and out. In fact, most of the time that I work as a doula in the hospital, I'm there through all 7, 8, 18, 24 hours of the labor. And I see the doctors come in and out, and sometimes you'll see the nurse, the nurse who's on call or who's on staff when I come in, leaves, goes home, gets a good night rest, and comes back to work the next day, and I'm still there with the woman. Especially if you go into a hospital and not, a public hospital, not a private hospital, you never know who's going to be on staff. So the doula is somebody who hopefully knows the woman, knows her wants and desires, and can be there for her throughout the duration of her labor. Also, a doula provides suggestions for position changes. A lot of times, our hospital staff doesn't have the time to really get in there with the woman and help her specifically throughout her labor. They've got many patients to deal with, so they don't have the time to sit there and say, "Why don't you try on your hands and knees? It's significantly less painful than lying in the bed." They don't have the time to do that. And also, they're dealing with the medical side of things, so they don't have time to deal as much with the emotional side of things. So that's also something that a doula does, is offer emotional support, which is a really big deal. It's a rite of passage. It's a huge transition in a woman's life. It's a emotional, spiritual change, and the woman will never be the same. If a doula speaks another language, they can help women who don't necessarily speak English understand what's going on when she's in a hospital with English-speaking staff, which I think is really important for women during this time in their life to know what's going on. And if they don't speak English as a first language, sometimes it's really hard for them to understand what's going on. So a doula can provide that sort of bridge. Also, sometimes medical staff talks in a way that is confusing to people. Women who don't know anything about, what is normal during labor, or, what they should be doing, or even the fact that they have choices. And then the medical staff comes in and talks in a way that's sort of hard to understand. A doula can be there to explain those things to her and sort of bridge that language gap as well. I think probably one of the most important things that I've learned is that, although we'd like to think in this world that everything is equal, it's really not. And some people are more supported than others. and I guess that I've learned to pay attention to that a little bit more, and to be more aware of that in my life. Most of the women that I help in the hospital have no other support with them for cultural reasons, because in their culture men are not allowed in the birthing room. It's just not something that they do, or because there's no one there for them. And it's my belief that all women deserve support and deserve good support, but not all women have it. Now is a very interesting time for birth in our society right now. There's a lot of things going on, a lot of policies being made, like banning VBACs in a lot of hospitals. A a lot of the policies are geared towards the medicalization of childbirth and, saving the woman from her pain or from her experience. But there are some really nice pockets of an alternative way of thinking in the United States, and those are growing. And that's really, really exciting. So it's a great time to be involved in birth. Also, because I believe that the two sides are getting more and more polarized, with banning, VBACs and then people moving and having doulas in a hospital. Doulas were not allowed in hospitals for so many years. And some hospitals still have bans on doulas. Now, as they're getting more and more polarized, it's an opportunity to come in and change this. And I hope to, ideally, in my life, many, many years down the road, I hope to create a different way, or inspire a vision for viewing birth in a different way than it's currently viewed in the medical industry.